Good day, I'm Jackie Judd. Every year in the United States, about 500,000 people end up in emergency rooms to be treated for injuries sustained in bicycle accidents. As some of you know from reading her columns, our own Michelle Andrews was in recent months among that 500,000. Michelle, who writes Ensuring Your Health, joins us today to discuss lessons learned about the healthcare system during her own treatment and recovery. We are especially glad to have you here today, Michelle. Thank you.
I'm glad to be here.
How are you feeling?
I feel pretty well.
Okay, let's briefly set up what happened. Bicycling in Quebec. You hit a gravel patch.
I did.
And you ended up in the emergency room.
I went flying, and yes, the ambulance came and took me off to a regional trauma center in eastern Quebec and whisked me into a trauma bay, and they did a series of x-rays. But this wasn't the kind of experience that you'd probably see in the US, where they'd wheel up an ultrasound machine and they'd check you out for internal injuries, and they'd do head-to-toe CAT scans or CT scans to make sure that there weren't any extra broken bones that didn't show up on the x-rays. It was a very minimalist approach to emergency care.
And the diagnosis then?
At the time, they said I had a broken shoulder in a couple places and a broken thumb. And I was really uncomfortable in my pelvis and hip, and they said torn ligaments, torn cartilage, or not cartilage, ligaments, muscles, strain, that kind of thing. Just get out and walk on it. That was when I left.
And over a period of time, you learned something very different. And what was that?
Well, I found out that, in fact, the shoulder, the thumb, those were all, yes, indeed broken. But in addition, I had 3 breaks in my pelvis and a partial hairline break in the left femur, my left thigh bone.
That were not diagnosed.
They were not
Canada.
Diagnosed in Canada.
So, how many surgeries did you end up with? How many specialists did you end up with? And what were your impressions of the healthcare system you've been reporting on for so many years, and now you became very much a part of it?
Well, I had 2 surgeries. I had my thumb operated on and my left shoulder. And I saw different specialists for, well, 3 different orthopedists, because they all specialize, of course. So, you know, the guy who did my thumb didn't know anything about shoulders, and the woman who did my hip doesn't know anything about knees or shoulders, or, you know, they're all specialized. So I had 3 different orthopedists and a few that I discarded. One orthopedist looked at my pelvic injuries and he said, "You need to be in a wheelchair right now." And I got a second opinion, and she said, "You don't need to be in a wheelchair. You need to use a crutch." So that's part of what surprised me about this whole experience, was that there was so little clear right and wrong in terms of what medical treatment I needed. And my injuries, this wasn't a mystery disease. You know, I had some broken bones. I thought it would be pretty straightforward, but in fact it wasn't. And, you know.
So it sounds as if there wasn't real data to depend on to help you make your decisions. How did you make your decisions? Instinct? Comfort level with the doctors? How did you do it?
Some of it was instinct, certainly, asking a lot of questions. I mean, I did ask a lot of questions, and I learned that, you know, what everyone says about needing to be your own advocate is very true, because when you're talking with a doctor, a surgeon, you know, they do surgery. They're often going to recommend that. And so I did try to question them closely about whether it was really necessary. Was it? I don't know, because as you say, there is no data to rely on, and I would try and just work my best to figure out what was the right answer. And, you know, in the end, I decided to have surgery in 2 places.
Particularly since the Affordable Care Act, the reform law, was enacted, there has been a lot of talk about the need for patients to have a medical home, a place you can always go back to, someone who will know everything about your health. Did you have that?
As it turned out, I did. I had never thought of my primary care doctor as my medical home. I didn't see him that often. I've luckily been pretty healthy, so I haven't had to have a lot of interaction with the healthcare system until now. But he really stepped up to the plate. He first of all taught me about the just stuff I needed to do to care for all the abrasions I had. I mean, I had cuts and scrapes all up and down my arms and legs, and they needed to have the dressings changed twice a day. And but he did much more than that. He made sure that I had my surgical clearances so that I could have the surgery. He recommended second opinions, doctors to go see when I asked him. He, when one of the doctor's offices wasn't calling me back, he picked up the phone and nagged at them. He said, "You have to see this woman, call her." And after my surgeries, he got in touch and he said, "So how's it going? You know, how'd the shoulder go? How's your hand? How about that guy who wanted to put you in the wheelchair? What happened with that?" That was much more than I expected.
Part of being in the healthcare system, of course, as so many of our viewers know, is the billing that happens afterwards. How did you find that?
Well, I'm still finding out how that goes because the bills keep coming in. I have a plan with a $1,500 deductible, and I generally have to pay 20% of the charges beyond that. So it's costing me some money to have this care. And I think about consumer-driven healthcare and the advocates who say, you know, people will make smarter decisions if they have more financial skin in the game. And I don't actually think that that's making me make any better decisions at all. I think that it's just costing me money.
And the bill in Canada?
The bill in Canada was quite small. Altogether, only a little over $1,000.
It was for that one emergency room visit?
Yes.
Okay.
I just got the itemized bill. I can't really tell you what the specifics are on that bill because it's all in French. But they did include a little insert about how to pay, and that's translated into English, of course.
You look terrific, but your arm still
a work in progress.
The mobility?
I can get it up to about here, but I'm doing a lot of physical therapy. And I should get back to 100%, well, close to 100%.
Very good. We will look forward to that, and thank you for coming.
Thank you.
Michelle Andrews.